Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. And as always, today is your chance to get your questions about public health answered. We'll take your COVID questions, but increasingly, and I'm happy to be seeing this, a lot of the questions coming in are about what happens after COVID. How do we take lessons from COVID, use them in other spaces? That's something CDPH has been thinking about since the very beginning here. Our whole strategy has been not to build temporary scaffolding, but to really make sure we're investing in places and programming that has health equity at its focus, but that also takes these lessons from COVID and really turns them into lessons that we build on and extend long-term, for decades in Chicago. So to that end, I'm really pleased to have two special guests with us today. This is Aisha Jaco. She is the Executive Director of West Side United, and we'll hear a little more about that. And then Theodore Crawford, the Executive Director for the Garfield Park Right to Wellness Collaborative. Two just amazing leaders, amazing partners of the Chicago Department of Public Health, and they're going to talk a little bit more about some of the exciting work that's happening on the West Side in partnership with Healthy Chicago Equity Zones. But just to sort of get it in your mind, because folks, as always, you'll be able to put your questions in. You can use the hashtag #AskDrArwady either in the box below or using that hashtag on Facebook or Twitter, and you can ask questions for any of us. So thank you so much for joining us. And I gave people just your name and your organization, but let folks know just a little bit about the work that you do.
Thanks for having me, Dr. Arwady. Again, my name is Aisha Jaco, proudly serve as Executive Director for West Side United. And our overarching goal is to create a better quality of life by addressing the life expectancy gap between Chicago's Loop and 10 West Side communities, including Garfield Park. And so we do that by looking at the social drivers of health, economic vitality, neighborhood and the built environment, access to care, and education in partnership with 6 anchor hospitals and a multitude of community partners and residents across 10 West Side communities.
Love it.
Yeah, so we're like the localized version, but not quite as dynamic as West Side United. So Theodore Crawford, Executive Director of the Garfield Park Right to Wellness Collaborative. Our mission is really to work with a collaborative of stakeholder organizations and residents to improve the quality of life and improve also the social, economic, and spiritual well-being of folks who live in Garfield Park.
All right, love it. So we will, as always, we'll take a look at the COVID dashboard. We'll go through a little bit of where we are on COVID, but then I'm going to let our guests actually share some more about their work, and then we'll take your questions about COVID specifically, but also about this work and about what we're thinking about going forward in public health in Chicago. So let's go ahead and pull up the dashboard, chi.gov/COVID-, and take a look. So first of all, Chicago's COVID risk level is low. That is what we like to see. And if we take a look at the details here, generally we're mostly seeing green here and no big spikes in anything. We're averaging still more than 300 laboratory confirmed COVID cases in Chicago residents every single day. That doesn't include the hundreds or even thousands who are diagnosed daily through home tests. We still also have about 24 Chicago residents every single day being newly hospitalized with COVID. So it is not gone, although it is in much, much, much better control, especially important for folks with underlying conditions, those who are older, to stay up to date with vaccines, to use the treatments that are available if you do get sick. And then deaths, we're still averaging less than 1 per day, which we like to see. We're still doing almost 8,000 vaccinations every day here in the city of Chicago, which is sometimes a surprise to people when I'm talking to them about it, but that's been good to see. And right now, COVID, only about 3% of our hospital beds are taken up by COVID patients and less than 2% of our emergency room visits. So not a big stressor on the health system right now. And in that context, overall, keeping an eye on things, but relatively pleased with where we are. So our overall risk, as I said right at the top, remains low. Reminder, we update this once a week. And this is calculated every week looking at how many lab confirmed cases we have per population, how many hospital admissions per population, and then what percentage of our beds, our inpatient hospital beds, are taken up by COVID patients. And if either the city of Chicago or Cook County overall were to tip above those thresholds, that's what would move us week by week from a low potentially back to a medium level. So everything is still looking pretty good. The one that we're watching the closest is on hospital admissions. Our goal is to stay less than 10 per 100,000 population over the week. And you can see within the city of Chicago, we're well below that at 6, but Cook County overall is getting a little over 8. So that's been creeping back up again, and we'll be keeping an eye on it. But for now, still very much at the low level. And that is where most of the country is. Green represents county by county across the U.S., places that have a low COVID level. Less than 3% of counties are at a high level. Remember, at a high level means you're seeing a lot of cases, but also you're really starting to see big stress on the health care system, 10% or more of their beds being taken up by COVID patients. And so you can see we have just 4 counties down in downstate Illinois there that actually are at a high COVID level. Some of those hospital systems can get a little more stressed a little more quickly when we see a localized outbreak. But overall, things are looking pretty good. About 16% of counties in the U.S. are at that medium level. And I'm confident that, we've been at low for a good long time here. We actually didn't even hit high at this point during this winter, which I've been really pleased to see. We've been between low and medium. We may see medium again here, but we've been able to keep out a high, which I am very, very pleased about. Just quickly, because I know a lot of you cover the variants, so we're still watching this XBB.1.5. That's been the variant. It's in purple there. That's been growing the most. It's the most contagious variant yet, but the main thing is it's all still Omicron. So if you're up to date with your Omicron vaccine, the one that became available after Labor Day, you've got the best protection against these variants. But that just as we've been predicting, that XBB.1.5, that subvariant, is now up to about 89%. So nearly all of the cases that we're seeing in Chicago and across the Midwest. But it's not behaving differently in terms of putting people in the hospital. It's just really contagious. And if we look out on the East Coast, almost everything is that dark purple, that same subvariant. So no new surprises. The best news is it's all still Omicron. And that's the one thing that we're watching the most closely. And then we're continuing to just monitor community level COVID case rates. All of this is available on the dashboard. I just pulled up one to give you a sense here. So these are people who are being diagnosed formally, meaning they're generally seeking medical care. They're going to the doctor, they're going to the emergency department, and we're still seeing some clustering, a little bit on the south side there and a little bit on the far north side. Everything, though, is still at a pretty low rate, but we keep an eye on this. And remember, one of the things that CDPH has been working to do is build other ways to monitor not just COVID, but infectious diseases or even opioid overdoses without needing to be dependent on individual testing. So wastewater has been one of the main areas there. And so I want to really emphasize that we're still learning about wastewater. Every week we're working with a lot of academic partners and a lot of folks really across the country figuring this out. But if you look back, this is our sort of overall City of Chicago wastewater metric, and to the right there, that's our most recent week. We're at a medium risk there, down a little from where we were, no major spikes, but we are definitely seeing ongoing community transmission. And then just to give you a little sense of how that's working, we both look at COVID wastewater levels at the big treatment plant area. There's 3 big water treatment plants, one that serves the north side, one that serves sort of the middle of the city, and one that serves the far south side, as well as parts of Cook County. And we are seeing some higher levels in that middle level right now, which can reflect Cook County, but that's where we're seeing a little more. And then where we do sewer shed sites, which is smaller populations within Chicago, again, sort of in the Chicago Lawn, Roseland area, some of the same areas that we're seeing some more cases, we're seeing some higher levels of wastewater, but nothing that is alarming at this point. Again, not new variants, but just wanted to give you a sense of that. And then in contrast, all of our treatment plants and all of our community sewer sites are currently showing a low influenza level for both A and B, and that is very consistent with what we're seeing for flu. Flu is in good control right now. So we continue to work on this. And then the last thing I wanted to just highlight is we've been getting some questions, is anybody still dying from COVID? And unfortunately, yes, there are still people dying from COVID. We've had more than 8,000 Chicago residents die. The people who tend to be dying now, a lot of them are older. That's why it's especially important that older people stay up to date with their vaccines or take the medications if they do get sick. But I wanted to just give you a sense of this. So this is showing how many Chicago residents have we seen? This is by weeks of the year here. So the worst 2-week period in Chicago for COVID deaths was back in 2020, the 18th and 19th weeks of the year. So that would have been around May of 2020. And we had 651 Chicago residents die of COVID in just 2 weeks. Like, remember that? That was... I never want to see a time like that again. In comparison, if we look over these last few weeks, weeks 6 and 7 of the year, we had 10 Chicago residents die, right? Weeks 4 and 5, we had 14 Chicago residents die. So it is not zero, and I really want to emphasize that, but it is also really far from 651. Similarly, our highest risk setting remains the long-term care setting, the nursing homes. So we've got teams that are in there. We've got 79 facilities, and every single time we're seeing even 2 cases, we're sending folks in, we're working with SIMPAR, which is an organization that can go and bring IV meds and bring the treatments and make sure people are vaccinated. But those same 2 really bad weeks in 2020, we had 340 Chicago residents just living in nursing homes die in that 2-week period of COVID. I mean, just remarkable. And we've seen no COVID deaths in our last couple of weeks. So again, real progress, not over, but in a really different place. So I'll just remind you to take action if you test positive for COVID. Days 1 through 5, nothing's changed here. You should stay home. If you're at high risk for severe illness, you should talk to your doctor about getting early treatment. After day 6, you can end isolation, but you need to wear a mask days 6 through 10, assuming that you're feeling better. That hasn't changed, and I don't expect it to change soon. And then, as I've said a couple of times already, with vax and PAX is what we really think about, especially for people who are over 50 or people with severe illness. You got to be up to date with your vaccines, but a belt and suspenders here. If you do get COVID, we also want to make sure you're getting those treatments that really help keep you out of the hospital, help keeps the virus from copying in your body. So Paxlovid is one of the examples. It's an oral treatment. It is free, at least for now, and you want to take it before you get too sick. So sometimes I hear people say, oh, I'm not that sick, I don't think I need Paxlovid. No, like if you're at high risk, if you know, my parents, for example, get Paxlovid, even if they're not, I mean, if they get COVID and they're not feeling that sick, I want them to take Paxlovid to help prevent them from getting sick. We've given close to 600,000 of the updated boosters. That's the vaccine that became available around Labor Day, the one that is specific for Omicron. Everybody should get this. We're a little bit ahead of the national averages, but it's nothing to brag about here. Still, about 25% of Chicago residents over the age of 18 are up to date with their vaccines. And especially I'm worried about those over 65. Only about 41% of Chicagoans over 65 are up to date with their vaccines. And that's what worries me the most. That's also, we're lagging the U.S. population a little bit for those who are older, even though we're ahead of the national average. So just a reminder, you should get your, if you haven't had a vaccine since Labor Day, you're due a COVID vaccine since Labor Day. And we are continuing to operate our at-home program. So you can give us a call, 312-746-4835. You can go to chicago.gov/at-home. We have just given demand, we've dropped this back a little bit, but we're doing 3 days a week, Saturdays, Sundays, and Mondays, 8 a.m. to 6:30 p.m. We'll get everybody over the age of 6 months up to date with COVID, and as long as somebody's getting a COVID vaccine, we can get you up to date with flu. That's in addition to being able to get the vaccine, of course, through your doctor's office, through your pharmacy, through many other sites, but the at-home continues to be popular, and we're committed to it. The last thing I wanted to highlight before I hand it over to our guests is we've been talking really each week about, as the public health emergency is ending in May, what are the things we're worried about? What are the things we're working on? And today, I just wanted to highlight that one of the biggest gaps that I'm worried about is what we are going to do for uninsured or underinsured adults. We have an amazing program in this country called Vaccines for Children, VFC. It's a federal program, and it makes sure that all children under the age of 18 can get all of the recommended vaccines free of charge. Doesn't matter if they're uninsured, underinsured, undocumented, and the Chicago Department of Public Health administers this program. So we get millions of dollars worth of vaccine, but then more importantly, we work with hundreds of pediatric providers who administer those vaccines, who do the reporting. They are our natural clinical partners for outpatient care for anything affecting children. And we are really hoping to see a vaccine for adults similar program get authorized at the national level. Again, this is nothing about vaccine requirements. This is nothing about changing things that your doctor recommends, but it's making sure, you know, vaccines are one of the most important things that save costs, that save disease, but that also let us set up these preparedness structures. So in the same way, I have hundreds of pediatricians and hundreds of federally qualified health centers who are very used to working with the public health department around the health of kids for the VFC program. We've built a lot of this during COVID. We'd really like to sustain it. So we're hoping. I was in DC last week, and one thing that I was doing was helping educate legislators about the need for a vaccines for adults program. It's really pretty inexpensive in the grand scheme of things, but it would make a big difference for us to be prepared. I always just remind folks that 211 is now live. So in the city of Chicago or in suburban Cook County, you can now dial 211. And there's a live person on the other end of the phone who can help you get help, whether that's for social service needs, housing needs, food needs, mental health needs. Give us a call. It's new as of this calendar year. We're excited about it, and you can check out the website. And as always, if you've got COVID questions, you need a vaccine, you need a booster, you're trying to find Paxlovid, you can give us a call 7 days a week, 312-746-4835, or check out the website. And so with that, I am going to hand it. I already introduced briefly our guests here, Aisha Jaco and Theodore Crawford, and I will hand it to you, Aisha.
Sure. Thanks, Dr. Arwady. And again, thank you for welcoming Westside United to this space. It's always an honor to work with you and learn from you. And so today we're just going to highlight some of the work that we've done in partnership over time, recently, and of course at the onset of COVID. So just want to take folks through who we are. Our mission is to build community health and economic wellness on the west side of Chicago, ultimately with the result being healthy, vibrant neighborhoods. We work to improve neighborhood health by addressing inequities that we have outlined that exist in healthcare, education, economic vitality, and the physical environment. And this cross-sector, place-based strategy is very important to our model, leading with community voice, aligning with the appropriate partners across healthcare, education, the faith community, business, government, so that we all coordinate our investments to reach our shared outcomes. And ultimately, the goal is to decrease the gap between where we sit here today and across the west side. And so, you know, one of our strategies is by leveraging the power of our healthcare partners. So we cannot do this work without partnership. And so that's through the leadership of Ascension, formerly AMITA, Lurie Children's Hospital, Cook County Health, Rush University Medical Center, Sinai Chicago, and UI Health as our core partners. They're important because if combined, they'd be the #1 employer in the state. Their ability to invest in the West Side is massive. And so there are a lot of benefits from this coordinated effort being driven by our partners. And so we are very thankful to have them be part of the model and to drive the work alongside community, of course. One of the first ways in which we worked very deeply together was in the creation of the Racial Equity Rapid Response Team.
Right, way back at the early days of COVID.
Yes, I mean, we literally got a call from the mayor's office on a Sunday night cooking dinner to sit around the table the next day to think through how to create a data-driven strategy to mitigate COVID-19 and to look at the high rates of mortality and morbidity first across Black and brown communities. And so the formation of that under the leadership of the city's Health Equity Department, all of our healthcare partners, community leaders from Austin, Belmont-Cragen, South Shore, Auburn-Gresham, we sat around the table, and the pillars were to look at education, prevention, testing and treatment, and support services, and to activate that. And ultimately, we were able to deploy large-scale food operations, PPE, ultimately testing, which from this table evolved the work in our partnership with Protect Chicago Plus. And if we fast forward to where we sit today, now the Healthy Equity or Healthy Chicago Equity Zones. And so with Westside United, we're the regional lead for the West region, and our partners are listed here: Esperanza, Austin Coming Together, Erie Neighborhood House, along with Erie Family Health, Sinai Chicago, Enlace, Breakthrough, and Equal Hope. And these are across our 10 communities. We're really 9 because we don't count Belmont Cragen here. And so the effort is to really, again, work together as a unit so that we don't reinvent the wheel and so that we're timely in our delivery of service. And so in our first round of partnership, we were really looking at vaccine equity. And in this piece, it was around engaging close to 28,000 residents around our varying vaccine equity strategies. We got close to 4,500 doses that went out, and we had over 400 outreach and vax events. So again, this was due to the partnership of working with the Department of Public Health, but most importantly, our community anchors, so much so that we were able to, during this period, increase the vaccination rates by 8.5% in our region.
Right, and this was, just to put a little finer point on it, this was sort of after the Beanie Baby phase when everybody was showing up and there was a lot of excitement. This was really this work of when you're going back and having a second conversation and a third conversation and working to kind of build that trust. And, these vaccines at this point are harder to get and some of the most critical. So thank you for all that work.
No problem. Teamwork makes the dream work. And so going out of that phase, it was then looking at health and racial equity and thinking through how we identify the priorities for community in the region. And so part of that was our team at Westside United, under the leadership of Mignon Do, Eve Shapiro, Ladarius Curtis, was taking community through a journey of assessment. And through that assessment period, thinking through some of the traditional forms of data collection, and then also listening to community for what they knew to be true in terms of ways to activate community voice. That then led to us identifying and prioritizing the health needs that community wanted to look at, and we're currently working through the action planning. So again, this is all in partnership with the Department of Public Health. And then you just want to paint the picture of how we got community voice, how we work to put together our data sources by looking at the Health Atlas and primary indicators there. Again, we led the charge for community input, looking at Metopio, looking at the Alliance for Health Equity. So again, this partnership is a through line on every level, and we're just thankful to have public health under your leadership really leading the charge to think differently about how we impact community. And that is a great segue into our work in Garfield Park, which happens to have the lower life expectancy across our 10 communities. We are members of the Garfield Park Right to Wellness Collaborative. We are the recent recipient of the Chicago Prize. And I want to turn things over to TJ now to walk us through the work of the collaborative and how it all ties in.
Let me clear my throat real quick. Relaxed and listening to Aisha is always a pleasure, and I'm happy to be here. So the work of the Garfield Park Right to Wellness Collaborative really evolved out of a group of residents, faith-based and healthcare institutions, nonprofit, and other partners that work in Garfield Park. Our mission is to cultivate something that we call Black culture wellness by addressing the spiritual, socioeconomic, political, and physical needs of Garfield Park through engaged and cooperative community participation. We have a founding board of about 14 organizations, as large as Rush, as community-centered as New Mount Pilgrim Missionary Baptist Church, Ma'afa Redemption Project, Garfield Park Community Council. I guess since I started naming them, I should name them all now, right? Bethel New Life, Bobby E. Wright, the Community Builders, Habilitative Systems, the Institute for Nonviolent Chicago, the Leaders Network, Nation Builders Construction Group, Project Forward, Rush University, United for a Better Living, and of course Westside United. So we all work together as part of the collaborative to address these 5 focus areas that we have. So the main, planning document that we've been working on in and really are in the midst of doing now is the quality of life plan. Then we also have now completed a Madison-Pulaski corridor plan. What does it look like for the businesses in the commercial district to have both traditional commercial but also resident-driven business and commerce that meets all of the needs of community. We have a behavior change marketing campaign that we call the Right to Wellness, which is embodies the spirit of what we do in terms of our name. When we talk about right, we spell it R-I-T-E, so it's a rites of passage. How do we move from one state of health with an experience together, you know, all of the things that really build a relationship, and then how do we evolve into a better state of health, right? So what are the things, what's the information, what do we need so that we could then adopt these healthy behaviors that will lend to our betterment, but then also the betterment of our children and generations to come. Then we have neighborhood activation, which is something that really came out of our partnership with the city. We're going to touch on, you know, something that now has evolved into the CSCC a little bit later, but that looks at how do we look at vacant lots and other spaces that are traditionally unsafe and then make them safe. So part of the partnership evolved or I guess culminated in the building of the Garfield Park Community Plaza and Outdoor Roller Rink, which took a vacant lot that had, you know, cars sitting on it and some other type of activities, and now it's a kind of a safe haven in the midst of downtown West Side where folks can go in and skate and hang out, chill, get good food, and just really kind of immerse themselves in the spirit and the principles that undergird the collaborative. And then the last piece is the Sankofa Wellness Village. It started off as the Sankofa Wellness, or started off as the Wellness Center, and then as we evolved and we started to hone in on the concept and our theory of change, Sankofa Black Culture Wellness, it then evolved into include 3 other pieces that we'll allude to as we move through the slides. But it's how do you build, the church came up with the concept a while ago of building a village within a city, and then what does it look to make sure that, what does it look like to make sure that a village is really based in health and wellness principles, right? That not only are things that are talked about, but are lived and then produce outcomes that are reflective in the individuals and the families and the larger community as a whole. So we recognize the challenge, and Aisha alluded to this earlier, you know, the life expectancy gap, right? We want to be able to not lower our life expectancy in one area. Like normally when you try to close gaps, you want to bring people to the center. We don't want to do that. We want to go to the extreme of life and move our whole community to the greater extreme, right? So, you know, currently in West Garfield Park, 67 years of age has been the life expectancy. If you go to Oak Park, it's 82. If you go to the Loop, it's 80. How do we make sure that the folks in Garfield Park have those additional years that's natural to us? And then some of the things that we've talked about in doing our research and planning is how do we make sure, or well, one, we ask ourselves the questions, what will we do with an additional 15 to 17 years of life? And not only that, what will we do, but what will we do if those years were quality, right? Not just what we currently experience, but how do we improve all of the different circumstances that lead to healthy communities? And then how would that impact individuals, right? What would be the greater quality of our individual life, but then what will we produce? What will we sustain, right? What would be that which our children then see and then they pick up and they sustain as we move forward? So we're excited about that process, and we know that all of the different elements of the village are very important to that. So again, going into some of our challenges, we talk about the population. 25% of the population of West Garfield Park has declined, or should I say the population has declined by 25% since year 2000. 51% of households make less than $25,000 per year, and unfortunately 48% of the children in Garfield Park are living in poverty. Housing, over 25% of the homes are vacant. Less than 1% of the housing was developed in the last 20 years. Home ownership rates are less than half of the region, and half of the households do not have access to the internet. Healthcare, 57% of residents have a primary care doctor, 16% lower than the Chicago average. And then there's high rates of preventable hospitalizations, emergency department visits, and dental emergencies. So all of these inequities greatly impact not just the life that we live, but the life that we expect, right? When we see around us evidence of what injustice has caused, and there's not enough hope, then folks can believe that the current reality is our only reality, which then speaks to the solution. So under leadership of Westside United, Rush, Dr. David Ansel, Reverend Marshall Hatch, and others, we have come together with the collaborative to really provide a solution that's community-led and community-driven. Our vision, as we talked about, is to advance the economic, physical, psychological, and spiritual health of West Garfield Park residents. And then, of course, again, going back to what Aisha talked about, addressing the root causes of health disparities and the life expectancy gap, and then utilizing the tenets of Sankofa, where you go back in order to move forward. Rather, we first go back and recover the valuable things that we lost. So we've done this in tandem a little bit. So I'm going to invite Aisha to join me in this. I alluded to the 4 different elements of the Sankofa Wellness Village. So the Wellness Center, then we have the Ma'afa Center for Arts and Activism, then we have the K Entrepreneurship Development Hub, and then we have the Community Grocer Initiative, which is dedicated to making sure that there's a quality, community-focused grocer in the neighborhood, and really anybody that's selling groceries in the neighborhood are committed to community improving quality of life. We have a theory of change that I'll run through, and then I'll ask you to talk about the Wellness Center. So we talked about the Sankofa Black Culture Wellness Theory of Change. We have values and principles, right? 7 values, 8 principles, 9 evidence-based elements, and then 10 essential outcomes that make up the whole of the theory of change. And then as you see on the screen, you can see the different areas of inputs where we're looking at funding and space and materials, people and relationships, existing programming, planning, a whole bunch of stuff that we need to invest, and then a bunch of things that we need to do, right? So each one of the elements of the village are the different activities. So at the Wellness Center, people are going in and getting healed, right? They're seeing primary care physicians, they're getting mental health services, they're using the Y in the gym and hopefully some daycare services, and they're getting or banking at the credit union and increasing their economic vitality. All of these are ongoing activities that are necessary for us to all engage in to then produce outputs, right? And so we want to increase the number of jobs in the neighborhood, of course, increase the health of folks in the neighborhood. We want to increase the number of programs that are being initiated or somewhat connected to our different village partners, and a couple other pieces that we expect to then lend to what we call the Black Culture Wellness Wheel, is where you have balance in these 10 different areas of life. So social, economic, environmental, physical, emotional, cognitive, financial, occupational, spiritual, and arts, and also civics, right? If we have balance in all of those areas, we expect to see individuals to be healthy, but then what does it look like to be balanced as a community in all of those areas? And then how does that then create the environment that then fosters health? We oftentimes look at, well, what's wrong with these folks? What does it take for people to be healthy? It's very hard for folks to get healthy when they're living in unhealthy environments.
Yeah,
right?
People think it's health care. Health care is a piece of it, but it's not the biggest piece of it.
You need to create an environment, right, and the institutions and mechanisms that undergird that environment that then foster health and well-being, right? In the meanwhile, we got to put on our oxygen tank and our mask so that we can swim through the polluted waters. But the real goal is how do we filter that out so that the waters are healthy, and then we can then be our natural selves. So Aisha, can you talk just a little bit about the Wellness Village?
Sure. So, very excited, and also just to note the Pritzker-Traubert Chicago Prize really giving us a boost in making this vision a reality.
Make sure you tell folks what that was. I didn't want to steal your thunder, but it's exciting.
So we were recipients of the second Pritzker-Traubert Chicago Prize. It's a $10 million prize that is positioned for capital improvements in neighborhoods. And so we're very excited that we are doing this work in partnership with the Pritzker-Traubert Foundation in Garfield Park, because it is a catalyst for us doing the work of the Sankofa Wellness Village, which includes the Sankofa Wellness Center, which again, partnership, community voice, and leadership is critical to the success of this project. So in the Wellness Center, we have anchor institutions like Erie Family Health, which is an award-winning federally qualified health center that has a massive footprint already, but that is coming in to provide services. We have Rush University Medical Center that will co-locate a center for well-being. We have the YMCA bringing recreational supports to this space. We have the Leaders Network that will have a credit union, and then you'll have the offices of Westside United and services that we'll bring in terms of localizing a hiring strategy, supports for small businesses, and then the Right to Wellness Collaborative. So this is a one-stop shop, a one-door approach that we hope will help bolster a lot of the things that TJ has, or Theodore has spoken to in terms of the vision for this space being one of the pillars and driving forces for health, wealth. So all of those drivers that we as Westside United look at too. This is a place-based approach in the community with a lower life expectancy for us to roll that out and really be successful.
So then we're also, one of our partners, the Ma'afa Redemption Center, they have what we call the MAC. So that is the Ma'afa Center for Arts and Activism, where it's the headquarters for the Ma'afa Redemption Project, which is a residential leadership and career development program for Black and brown young men. And it also will act as a regional arts and development and performance center. So when people need to have events, when they're looking to have, dance presentations, exhibitions, anything that you could think of, and we traditionally think of arts and media, we expect these things to take place at the MAC. Then we have the K, and I'll let you follow up the Community Grocer Initiative. The K is a social innovation hub that supports the revitalization and financial well-being of West Garfield Park. It's located right on the corner of Madison. It will be. They have it, but it's still in development stages on the corner of Madison and Costner, which is the main thoroughfare of the neighborhood, and it is being set up to support resident-owned businesses who want to develop, own, and occupy real estate along the Madison-Pulaski commercial corridor. It also will connect community members with like-minded entrepreneurs and facilitate networking and skill sharing. And it'll provide human resources, legal, technology, and marketing support for those people who are members of the K. And that's being put forward by True Delta, an organization called Project Forward. Then we have the Community Grocer Initiative.
Absolutely. So this is building off of community organizing. When Aldi shuttered in this community almost a year and a half ago, Save a Lot, for residents who wanted to come around a table to plan and leverage their ideas to bring resourcing in the form of a community grocer that is very responsive to the hiring needs of the community, the desire to have, like every community, access to fresh, affordable produce and groceries. And so in this convening, it is led through the Garfield Park Community Council under the leadership of Mike Tomas and Angela Taylor, who for decades have advocated for food equity in this community. So since that Aldi's closing, there have been pop-up markets that were funded in partnership with the council and Rush University Medical Center, Top Box, Westside United, to make sure that residents who in some cases were in walking distance of these shuttered stores still had that opportunity. So the spirit here is to organize and convene so that the next tenant coming in community adheres to a community benefits agreement and is working in concert with community around what folks want to see and have access to. So we're very excited about this work, and back to you, TJ, to walk us through the visioning.
So we'll close out with the slide presentation. I'm going to run through these last couple ones pretty quick. So this is just an overhead view of the corridor of the neighborhood, and you can physically see the walking distance between each one of the projects that we've talked about. So you literally can get to each one of those pieces, especially up here in the northwest corner of the community, in about a 60 to 90 second walk, right? So a block and a half. We have our major pieces that are just right around the corner from one another. And then of course we're looking to be able to positively impact the Save a Lot and make sure that we hold them accountable for how they, not only what they provide, but what the space looks like. And then we have the former Aldi site that Aisha just got through talking about as it relates to the Community Grocer Initiative. So, and then of course there are a bunch of other projects that community members are already involved in. There are other stakeholder partners that are doing work, and we're looking to be able to connect the dots amongst all of them so we create a network of a true village that's meeting the needs of the community. So then here's a picture of what Madison Street looks like today. And this is the corner of Madison and Kildare. And this is what we expect it to look like in 2025. You know, the building of the Wellness Center and all the services that it provides also helps to attract other investment, other development in the neighborhood. We're working really hard to make sure that the investment and development in the neighborhood is led by a community, not just in what we say, but also in what we do. So if there are folks who have dollars who are already buying up real estate or who want to come in and do some things, what's the strategic partnerships that you can make? And those of us who have resources, how do we invest in a way where we're able to take these visions that we have for community and turn them into reality for what we want, and make sure that everything kind of is a reflection of what we know ourselves to be. This is important because we're also changing the narrative of what Black folks, particularly in Chicago, West and South Sides, how do we define ourselves? How do we tell our own stories, right? How do we live up as we choose to, versus the stories and the realities that other folks have created for us that are far from our reality and how we see ourselves. So the buildings are a reflection of what we feel spiritually and physically and mentally of who we are, and we hope to ensure that that stays the concept throughout the process. So here's a timeline of when things will happen. At the end of the day, we hope to be able to cut the ribbon and have the Wellness Center open in February 2025. And these are some of the impacts that we expect to have happen in the community. This is what we expect to have happen within 1 to 3 years. Here's 3 to 7 years. And ultimately, beyond, we want to ensure that we have improved health outcomes, decreased community violence, a reduction in emergency urgent care, financial wealth for legacy and new residents, decreased incarceration, decrease in adverse childhood experiences, residents earning family sustaining raises, increased employment rates, increased community ownership, increased graduation rates, a network of trusted community resources, and we want to serve as a scalable model, right? We want to make sure that what we do here can then be expanded to the entire West Side, be able to connect the dots with other communities that are already doing work, and then if there are other communities in need, how do we then present this as a model that can be duplicated wherever it needs to be done?
Love it. All right. So I'm going to take it out of the slides and we'll have a chance to talk. So much to talk about there. First, I just want to say, like, I know about these projects and I still get excited hearing you all, you know, really go into some of the details of this, but also, you know, speaking with such clarity about being community led. And I, you know, this is something that CDPH has, I think, always wanted to do, but I think in COVID, it wasn't an option, right? Like, this was something, it's hitting the entire city, but it is hitting Black and brown communities worse, right? And we talked about essential workers in different ways, and it put some of these inequities that we've talked about for a long time, it made them, I hope, it made a lot of Chicagoans think about it differently. But then, I think where things did go well in Chicago, often it was because we really tried to say, let's not start a new table. Let's not start a new system. Let's work on getting resources into where there are long-standing experts in the places that they live, right? In Garfield Park, but in, you know, all over the city, and not dictate, you know, not say this is where this testing site is going to be, or this, you know, it's been different at different points. But I've been really excited sort of coming out of COVID about what does that actually look like. And part of the work of Healthy Chicago Equity Zones, you know, West Side United is our lead on the West, but the entire city has a regional lead and then these community leads. And in each of these areas, we've really tried to not dictate, right? And that can be pretty different. Usually a lot of government programs, these are often federal grant dollars that the health department is receiving and to put out. But we've really tried to say, the last thing that I want, you know, my team doing is showing up, you know, in an area that has already done a lot of planning, that understands where the needs are, that has built that. And instead, I want to like build this, you know, where we can support and grow and kind of row together on these issues. So a lot of people, I think, when they hear public health, they think about things like vaccines, but they don't think about things like credit unions. They don't think about things like grocery stores. So can I just, while I pull up people's questions, both of you were mentioning sort of life expectancy gap a little bit. And I have sometimes talked with folks here about why the health department chooses that as a goal, but can you elaborate a little bit about how you think that fits in to all of these other pieces and why that's an important one to choose?
Absolutely. So I think, it got embedded in our mission, given work that permeated out of Rush University Medical Center's Community Health Needs Assessment in 2016, where it put on paper what the inequities were and what the gap was, and it mapped it out eloquently across the train lines and across the West Side community. So that became our rallying cry, to stay the course and to think about within the healthcare anchors what was low-hanging fruit that we could think about in terms of the impact on jobs and hiring. So to your point around it being beyond access to care, which we ultimately landed on, it was thinking about how do we hire more? How do we invest more? How do we support the local ecosystem? How do we provide career pathways to get at one of the impacts in the village around creating a family sustaining wage? So all of those were really embedded in our DNA as a collaborative to think about what those touch points were, because to TJ's point, and in this place-based village, we know that we have to touch on all of those. It's more, you could put a clinic on every corner, but if you're not addressing the wealth in the community and some of the other factors, access to produce and other things that help with diet. So it's a holistic approach that we think that you have to be connected in at every level across those domains that we look at, which, as you mentioned, are complementary to Healthy Chicago 2025. And so the other piece is, in identifying it, how do you keep the continuity? And so it is very important for us to be part of Healthy Chicago Equity Zones as the West Region Lead, because that ties on to our metrics framework already. So we're not reinventing the wheel, we're magnifying it. And then when you talk about it from a hyper-local perspective, we now have this community collaborative that is, pulling from the model of Healthy Chicago 2025, West Side United. They now have a theory of change. So that's what we want to see. And I think what we're talking about today has really been an example of the activation of the possibilities.
That's right. I mean, it's been amazing, like really, to see this. Do you want to chime in on that?
Yeah. When we think about why the life expectancy is so much shorter in our communities than you would see in the West Loop, right? We have to really look at the social justice and really just policies, right, that don't address and don't approach issues through the lens in which the people see themselves. So you've had decades of public policy and public investment that has been directed and put into communities that oftentimes is the antithesis of what community would choose to do for itself, right? So the work that we've been able to do hyper local is to say, okay, hold on, right? We understand the things that we are currently experiencing. To a large extent, we understand what the inputs have been to create this experience. Now, if we want to have, and this experience is unhealthy, it's evidenced in all of the health determinants. It's evidenced in the life that we experience, right? Not just in the years that we live, but the stressors, right? The anxieties, the lack, right? The consistent fight that one has to have in order to be able to survive on a basic level. These are not things that are just natural to who we are when we're born. These are things that are natural to the environment that has been created because of all of those inputs. So now it's like, okay, COVID allowed us to pause, understand what's happening, and then recognize that really collectively, again, because this is not new, we have the power to do something different, right? And this catastrophic situation forces us to pause and stop and say, if we want something better, what do we do? And now we're in that process of not just saying, what are we doing, but what are we doing, right?
And I like this focus on, it's not new, but it is more newly resourced, partly because of COVID, right? And one of the reasons we've chosen at the health department as, our primary focus for Healthy Chicago 2025, every 5 years we do a plan for the whole city, and this is the one that takes us from 2020 to 2025, is focused on this racial life expectancy gap. And we've got epidemiologists that are always breaking down, how much of that gap is from opioid overdose, how much is from infant mortality, how much is from HIV and other infectious diseases. But the biggest driver of that gap still is chronic diseases, right? It's diabetes and heart disease and smoking-related illnesses, and it gets back to largely the conditions that folks are able to live in, the ability to sort of live a healthy life. And a little bit of it's about healthcare, but a lot, is there healthy food? Is there safe spaces for exercise? What does that look like?
Is there a system that affirms the lives of the people in that neighborhood versus
That's exactly
not?
Right.
It's very important to recognize, what does it mean to live in a community that celebrates you versus one that works to kind of change you or oftentimes penalizes you for communicating and being who you naturally are.
Yeah. And I like this thing that you were saying about it's also about seeing if what you see is what you know. Like, how do you create sort of healthier environments so that there's an assumption that life expectancy should be on par with the rest of the city, right? And not just in a numbers kind of way, but in a, what does that actually look like on the ground, I think is a huge challenge. Okay, we've got lots of questions. I'm gonna sort of go back and forth between some of the kind of COVID specific questions and then questions for you folks. So just to hit on a couple of the COVID ones quickly. So Tony Laporte on Facebook is saying, if we have the Omicron vaccine in September, do we need to get a second one? I've had a total of 4 COVID vaccines. Am I supposed to get a 5th? Thank you. So no, if you had the Omicron vaccine in September, that's the updated booster. It's the first time the COVID vaccine was updated specifically to help fight off Omicron. If you had that in September, you are up to date. If you had anything since Labor Day, you're up to date. So at the moment, there is still no recommendation for another booster, no matter how old you are, but you should come up to date with those. And we're continuing to follow the variants. We're continuing to follow what's happening in outcomes. But no, Tony, you are up to date, and thank you for being up to date. We will absolutely communicate if anything changes. But while everything is still Omicron, which thank goodness everything has still been Omicron for more than a year now, you've had the most important protection. And then Joy Bunton, similarly on Facebook, is asking, is it true that for senior citizens, the bivalent booster effectiveness wanes after just 2 months? So we definitely see some waning of protection after somebody's gotten a vaccine. But the thing you've got to understand is that there's the immediate protection. Your immune system is an amazing, complicated system, and it's got a part that fights off infection immediately, and then it's got a part that marshals the resources to bring the blood cells and the other responses in your body that can help protect you from getting really sick. And so what happens is when we see some of these very, very rapid, very infectious COVID variants, like some of these Omicrons, sometimes people can still get infected, but the part of your immune system that can rev up and say, oh, I just got infected in terms of sort of a cold or an upper respiratory virus infection, but I'm going to rev up and keep that from getting into my lungs and keep that from affecting my organs and keep me out of the hospital. That seems to stay very, very strong as long as you stay up to date with your vaccines. So one of the things that there's lots of ongoing work around the country. One of the things that the scientists are very much watching for is there a sign that we see a drop in this longer term protection? And at this point, we've not seen significant drop in this longer term protection, meaning if you're up to date, including with the Omicron, you remain quite well protected. We do see some more breakthrough infections, and that's where you want to pair that. If you do get infected and you're up to date, belt and suspenders, you want to pair that with Paxlovid. But generally speaking, there is not a recommendation, even for senior citizens, to get another booster right now. My guess is we will be be doing another round of boosters next fall, at the same time that we'll be doing flu vaccine, and I'm guessing this will be sort of a routine. Something could change in the next 6 months. The biggest thing would be if we saw a non-Omicron variant really emerge and had to think differently about those vaccines. But otherwise, no, you're up to date. Okay, so a number of folks and comments from you folks or on this. So people are, Jose Rodriguez on Facebook is just saying lots of work to get done. People are, there's lots of conversation here. So let me kind of choose one here. Very specifically, we've got a question here. What lessons has your organization learned from the pandemic? It's a big question, but I like it, so thank you.
I think we're still learning.
Yeah, go ahead.
It was definitely a stress test for our organization. It exacerbated all of the underlying causes that you mentioned. We did a decomposition analysis when we came up with our big, hairy, audacious goal to figure out what was causing the gap. And that ranged, as Dr. already alluded to, from cardiometabolic disease to infant mortality, opioid overdose, cancer, homicide as being key drivers, and now COVID. And what we saw is that when the first round of numbers came out looking at mortality, that in Chicago, life expectancy in communities like Little Village dropped by almost 4 years. The average life expectancy now for African Americans is right at 70, or in cases like Garfield Park, under that. So for us, we had this momentum of thinking about our mission and, you know, having certain numbers by 2030. COVID definitely has allowed us to pause, and now we need to retool our North Star to think about how we're responsive and receptive. We have always had community voice in the driver's seat of our work, so bringing community around the table was very affirming. To Dr. Arvady, what you mentioned earlier also around just bringing the folks who were true first responders in a decision-making space with public health, healthcare, and city government. That was transformational. So that will continue to be a through line, but I think just the pause and reflection on what we were aspiring to achieve by 2030, COVID presented factors that have just allowed us, or forced us in some cases, to rethink how we are approaching our work in the health equity space.
And probably too, right along with that, it helped to show in real time just how interdependent we are.
Yeah.
Right? So breathing the same air, living in the same spaces, needing to get access or produce or provide certain resources. Oftentimes we get into this ideology that I'm independent, I can do it all by myself. The pandemic showed that as independent as you think you are, truthfully, we are all dependent upon one another.
That's right.
The things that you do impacts me and vice versa. So then how do we ensure that the things that we do have the best possible outcome for one another, right? Intentional and in what actually happens. And I think, you know, the work that we do is a reflection of, you know, that relearning of the interdependence that we have with one another.
All right, and we've got a question here about the CSCC. Not everybody knows what that is. So can you talk just a little bit about the Community Safety Coordination Center, what that work has been like? That
work has been nothing short of inspiring, challenging, but still exhilarating. You know, for those of you all who may not be familiar, you know, the mayor, Lightfoot, took an outside of the box approach to addressing community violence, recognized the institutional contributors, right, to that violence, and wanted to have a kind of whole of government response to communities in need. So the CSCC, Community Safety Coordinating Center, is that idea in reality, where you have individuals from all of the city departments working directly with community leaders from 15 communities across the city of Chicago, 4 in particular, looking at what's the need, what is already there working well, right? Being led by community, what's being supported by the city, what is needed in greater coordination from both community and government, what other resources do we need to go out and secure to support what is happening, and then how can we increase the ongoing communication and coordinated activities so that we can address issues in real time. So you have these, I speak so passionately because I dedicate for the last year and a half, every 7:50 every Wednesday and Friday, right? Getting on these morning calls, and then doing a whole bunch of other work outside of that to figure out how to do all of the stuff that we just got through doing, or talking about rather. So it's challenging because, you know, you still got to deal with, you know, an institution like the city of Chicago, which has been in existence for almost 200 years, right? And the things that it does well and not so well, right? How do you unpack that, redirect, try not to tear down, but build, you know, scaffold so we could do better, change the mindset, or at least find a similar thought or theory of change for individuals that come from different backgrounds and experiences. And then with limited resources, but still more than what most people have, then identify where you should dedicate those resources where they can actually impact individuals in their day-to-day lives, as well as making sure that the investments we make now have impact 5, 10, 15, 20 years from now. So it's been a great thing to be a part of. You know, all of the data can show where there have been impacts around community violence. It's important to note that we are looking at non-traditional approaches, the things that community says will work and that we need to do that you traditionally cannot get policy to follow or get funding to support. Those things are being tried and implemented in a small level to be able to prove, you know, their validity and provide the evidence so that others can say, okay, that really does work, right? People are taking a chance on what community is saying. It's been good work, and I'm happy to be a part of it, and I hope that, you know, it continues, you know, moving forward, because it's a necessary thing.
Thanks. Yeah, it's interesting because when I think, you know, one of the things I'm the most interested in seeing is things that we figured out how to do in COVID. How do we use that for some of these other huge issues in our city, like community violence, right? And how do you make sure that is truly community-led? Yeah. Truly community-led.
And it's important, you know, I'm going to get this alley-oop to Aisha, you know, community violence, just as we looked at the other social determinants, it's a symptom, right, of other things that impact how we live and how we think about life and how we respond to the trauma, right, that we experience, because it's not just physical, but it's also economic, it's also mental. And the things that, you know, Westside United and the work that we're doing together works to get underneath that, right? You can't just look at violence and say, you know, take the guns out their hand. It's, well, the first obvious question should be how they got the guns, but after you get to that, why are we seeing these levels of violence? What is the real contributing factors that impact the things that happen in certain neighborhoods?
All right. So Chanel Rogers on Facebook is wondering, what communication tools or tactics do you think has been the most impactful for your community? What has brought the most engagement?
Well, I'll say, you know, at the onset of COVID, social media. You know, we were forced to be in the digital world, forced to be on Zoom, and so I know there were weekly report outs in partnership with your team, just as we did today with the COVID dashboards and connecting. So that's been one piece, and now as we come out and we're more in the physical space, sharing space, convening. So we call the West Side 10 communities. And so having anchors like a Garfield Park Right to Wellness, who also has a virtual town hall, but now have gotten back into the space of getting out and talking with people, breaking bread with people. Those have been effective. So I would say the digital world, although there's some fatigue with Zoom, social media, and then getting back to old school connecting, coming into spaces and places to talk, share, plan.
What do you think? What's best to get folks in the door, get folks wanting to engage?
As Aisha said, that personal engagement, and then each one reach one. Really, if we gather around the computer or the table in a space and talk about issues and are able to build relationships and see the commonality, right? We now have relationship, and then you become that authentic advocate that could then engage someone who might not have been in the room, but who has the same interests, right? So now we just slowly, and sometimes quickly, depending on, how, whatever the issue is, right? How urgent the necessity of response is, or the necessity of addressing an issue. Those connections, really, help to build. And then you surround all that with the digital stuff. You surround all that with podcasts and social media and newspapers and all of that other stuff. But if you don't have that personal relationship at the core, all that other stuff can miss the mark.
Yeah. And I would say too, in terms of governance, like if you're wanting community to be a fixture, how, think about the cadence in which you want them to engage, the platform. Is there a stipend?
At 7:50 in the morning, that's real commitment. Get folks at that time. Yeah.
So those are a few additions.
The structural pieces around what that looks like, absolutely. Okay, we are just about at time. I'll hit a couple other just non-questions here. Lisa Baldevenaria on Facebook is asking, what advice do I have about the stomach flu going around? The CDC issued a warning about a stomach bug rising in prevalence. What symptoms should people watch out for? How should they treat it? So a couple things. First is that when people say stomach flu, they don't usually mean flu like influenza. Influenza is a viral illness that we vaccinate against. It generally causes people to get fevers, to get sort of sick throughout their whole body. That's different than some of the diseases that go around and can cause like a diarrhea, for example. So we've had a couple things going around recently. We've had norovirus, which always this time of year, that's a virus that can be spread very easily, especially if you are in spaces where there's a lot of crowding or there's not a lot of hand washing. And so cruise ships are famous for norovirus outbreaks, but we also will see them sometimes in preschools and younger children's schools. Just really, really important for any of the diarrheal illnesses or the stomach flus. Hand hygiene is critical, and that means every time before you eat, every time after you use the bathroom, anytime when your hands are soiled. It seems really straightforward, but especially for children, they might not always think of it. And even for adults, really just getting in that routine. We all washed our hands a lot more during COVID, and that was part of what helped keep the stomach flus and these various things down. Shigella may be what you're referencing. That's a diarrheal type illness. It can be sort of serious. But if you are having really, not just I feel sick for a day or two, but really having trouble keeping liquids down, or having, so much diarrhea that you're starting to feel dehydrated, we want you to go see your doctor. Go see a primary care doctor if you really need to go to emergency department, but any of your doctors can actually do a test and see what is going on there. And if we do a test, the Chicago Department of Public Health gets all of those results, and it lets us sort of say, oh, there is this bacteria that's sort of going around, and what is that from? Is there a food that's causing it? Is there something connecting? But this is one of the reasons I'm very interested in things like wastewater surveillance, the ability to do some of that without being dependent on somebody to come in and get medical care. But the traditional way, whether it's a child or an adult, if it goes on more than a couple of days, and especially if you're starting to feel dehydrated or you think your child's dehydrated, just do go and see a doctor or a healthcare provider, and we will let you know if there's anything more specific in Chicago that you need to be taking action on. But in the meantime, wash those hands, especially this time of year. And then finally, Jean Brooks on Facebook is saying, I'm having a lot of trouble finding this broadcast. What's the best way to log on? I found it by accident this morning. So the best way is just to make sure you are following the Chicago Department of Public Health on Facebook or on Twitter. That's at Chi Public Health. And we post sort of when we're doing this, who the special guests are, what there's going to be. We also always post this on the Chicago Department of Public Health website, kind of after the fact, and they're archived and you can go back and take a look. But for in real time, if you found us, I'm guessing you're watching us on either on Facebook or Twitter, and just follow us, and then you'll be able to find it easily that way. But it does live in the same place each time. So we are just about at time. I wish I could keep talking to you for another couple of hours, but I hope you've really enjoyed this conversation. Again, in case you missed the intro, this is Aisha Jaco, the Executive Director of Westside United, and Theodore T.J. Crawford, the Executive Director for the Garfield Park Right to Wellness Collaborative. Really doing essential, public health related, community driven leadership work on the West Side. The Chicago Department of Public Health is really honored to help support some of this kind of work through Healthy Chicago Equity Zones, and really I'm just so proud to see what you're doing, and I want to do, and I want you to know that CDPH is really committed to this as an approach. It's a best practice all over the country to do this equity zone approach, and make sure that we're growing and supporting the work that makes people healthy in all ways, right? Not just in COVID response, but lets people have the opportunities and have the investments in the physical spaces and the investments in the human infrastructure that actually gets at that racial life expectancy gap. Because for me, I choose that one because you can't fudge it. You can't fudge it. It's very easy to sort of choose, you've got an initiative and you say, oh, well, maybe this outcome didn't quite work, but this one was good. And, I'm not about lying with statistics. I am about the truth. And I think that life expectancy is the ultimate barometer in how we are doing and how we're doing on health sort of as a city. And so that's why we've chosen it as a focus. It's how we make our decisions about what and where to invest. We do it in a data-driven way, and we really try our hardest. And every day, I hope we're getting better at this, to do this in a community-driven leadership way, because that's what got us through COVID, and that's what's, I hope, is going to make this city a city that can be healthy for you no matter where you live, no matter what the color of your skin is, no matter what your background is. We have a long way to go to get there, though. So thank you again to both of you. Any last words you want to say?
Happy to be here. Happy to have the opportunity to do the work.
Yeah.
We're continuing to grow to be good stewards of the opportunities that are given to us, not only as individuals, but as a community.
Yeah.
We're going to continue to challenge ourselves to meet the need and move beyond need into what we are destined to live as our best selves.
And we're just inspired to take our learnings from the onset of COVID around the power of the collaboration.
Absolutely.
And to continue that. So, we achieve our mission of eradicating the life expectancy gap.
Yeah. People always think outbreaks go wrong in terms of what do you do with cases. They don't. They go wrong in two places: communication and coordination. Mm-hmm. And the work of coordination is hard and critical work. And but if you don't work collectively, I think you can't really make those promises. So thank you very much, as always, for joining us and for your questions. We will be back at our regular time next Tuesday, the 14th, at 11 a.m., and we'll have more opportunity to take more of your questions directly. So thanks again so much for joining us, and appreciate all of your ongoing interest in public health in Chicago. Thanks.